of color continue to suffer from racial disparities in our healthcare system. A new report from the Commonwealth Fund found that African Americans in nearly every state are more likely than their white counterparts to die from preventable conditions due to unequal medical care. So how do we close the gap so that Black and brown people get the quality care they need? We welcome Alicia Coulter. She is co-founder of Advantage Healthcare Now, and this is a company committed to helping people in the healthcare space by providing health education. Happy Thanksgiving, and thank you so much for joining us today.
Same to you. Thank you for having me.
So how do Black and brown communities keep getting the short end of the stick when it comes to our health care?
Well, one of the reasons is we are more likely to be on Medicaid. And Medicaid insurance pays at a reduced rate than your traditional fee-for-service plan. And with that, you have physicians, quality physicians, that are less likely to take that health plan, and they're less likely to be in the community in which individuals of color are to be serviced. And so when that happens, we're not able to get the care that we need.
So we know the problem. What are some solutions to this issue?
Well, one of the things is currently President Biden has offered to give $1.5 billion to increase access to healthcare in those communities. And that's by way of providing funding to nurses and physicians. That's one of the ways. We also need to expand Medicaid. The other way is health literacy. As long as we don't have health literacy within Black and brown communities, we're going to continue to focus on treatment versus preventative care, meaning learning proper eating, proper diet, proper exercise to keep ourselves healthy.
That's a really good point, you know, the prevention and the education. But how do people gain access to this? I know your organization is part of that, but how do they gain access?
You know, that's the hard part. Access, especially with the pandemic and everything going digitally, has become very challenging. And so that's why organizations like mine and others are trying to walk the beat, you know, by doing canvassing and creating pamphlets and information, and also making phone calls out to our clients to make sure that they have the information they need. The digital divide is great. Everyone does not have access to Wi-Fi. Everyone does not have access to 5G. So that also helps to limit individuals. So we definitely need to step in the gap by actually going to individuals' homes and door knocking to give them the information that they need.
Yeah, it sounds like it really has to be at this point because of that digital divide that we know is so prevalent, a real grassroots effort. You know, we've also reported Black and brown communities have been hit the hardest by COVID. Is this also a result of racial disparities?
Oh, absolutely. It is definitely due to that. If you remember early on in the pandemic, you would hear about Black and brown individuals going to the hospital complaining of symptoms that mirrored COVID-19 and then being sent home without even being tested. And there were many that died in their home. So absolutely. And then as you see in the video, we love to get together as a family. And it's hard for us to be away from our family. Our family unit is so important. And with the various variants that are going around, it's easy for us to contract the virus, if we're not vaccinated. So yes, the disparities as it is related to COVID in the Black and brown communities are multifaceted. It's not just one simple fix the system really quickly. It's going to take a multi-pronged approach.
Yeah, because there are a lot of layers to this issue, and as we approach the holidays, it's especially important. So what is your recommendation for states to help eliminate these differences that we're seeing? I know you said on a federal level, possibly more money is coming, but what do states need to do?
You know, the way that you fix problems is money, right? Pouring into the communities that need it by way of providing services. Organizations like mine, we can't do this on our own. So we need funding in order to go out and do that. States need to also look at the policies that they have on deck right now and see if those policies can help reduce the gap. For instance, I'm in the state of California, and one of the things that our governor has done is there's a policy on book for Black women to have doulas when they're pregnant, to receive a year's worth of medical care once they give birth. Things like that, so that women, specifically Black and brown women and other women of color, have access to health care to help reduce those gaps.
So where can our viewers go to find out more information or learn about the resources that might be available that they don't know about?
I would say definitely start at your local Department of Healthcare Services and then also your state website. If you go onto your state's website, there's so much information there, and I know it kind of becomes a challenge because there's so much information, but I would take it bit by bit. Just take a link per day. And if you do not have access to the internet, there's also always the 211 line that every state has access to. And that's where you can get information regarding different healthcare services within your municipality.
Well, thank you so much for sharing this very important information with us on your holiday. We appreciate you. And we'll be right back after the break. This is BNC Live.